एवरीवन। मैं आरुषि नेगी इंटरनेशनल पेशेंट्स यूनियन से आप सभी का डॉक्टर आर में स्वागत करती हूँ। इंटरनेशनल पेशेंट्स यूनियन डिजिटल हेल्थ एसोसिएट्स का एक स्ट्रेटेजिक बिजनेस यूनिट है जो कि पेशेंट्स को देश भर के टॉप डॉक्टर्स, पॉलिसी मेकर्स, रेगुलेटर्स, इंडस्ट्री लीडर्स और फेलो पेशेंट्स से कनेक्ट करता है। आईपीयू का विश्वास है कि वो पेशेंट्स को सशक्त करें। पेशेंट्स यूनियन ऐप, जो कि एंड्रॉयड और आईफोन दोनों प्लेटफॉर्म्स पर उपलब्ध है, काफ़ी विशेष फीचर्स प्रदान करती है। जैसे आप अपने जैसे कई पेशेंट्स और केयर गिवर्स से जुड़ सकते हैं और अपनी बीमारियों को कैसे अच्छे से मैनेज करें सीख सकते हैं। आप पेशेंट्स यूनियन ऐप पर हॉस्पिटल्स, हेल्थ केयर प्रोवाइडर्स, गवर्नमेंट स्कीम्स को रेट करके अपने हेल्थ के एक्सपीरियंस को भी शेयर कर सकते हैं। पेशेंट्स यूनियन ऐप पर ऑथेंटिक रिसोर्सेज है और सारी सरकारी स्कीम्स की जानकारी भी प्राप्त कर सकते हैं। आईपीयू ऐप पर 34 डिजीज स्पेसिफिक कम्युनिटीज का हिस्सा बनकर आप अपने अनुभव को भी बांट सकते हैं। ये एक वॉइस इनेबल्ड ऐप है और कई भाषाओं में उपलब्ध है। आपकी प्राइवेसी के लिए आप अपने पोस्ट अनोनिमस तरीके से भी लिख सकते हैं। आप पोल्स में हिस्सा लेकर पॉलिसी मेकिंग में भी योगदान दे सकते हैं। हमारे ऐप में कई नई फीचर्स हैं, जैसे कि चैटबॉट जो कि आपको हेल्थ एडवाइस देगा, लिस्ट ऑफ डिजीज, लिस्ट ऑफ मेडिसिन, एडीआर रिपोर्टिंग, सिम्टम्स से स्पेशलिस्ट तक की जानकारी जैसे कई फीचर्स हैं। हमारी कोशिश है कि हम आप तक टॉप डॉक्टर्स को लेकर आए जो आपके सवालों के जवाब सरल भाषा में दे। मैं आप सभी का स्वागत करती हूँ डॉक्टर आर में, जो कि एक लाइव सेशन है जहाँ एक प्रसिद्ध मेडिकल प्रोफेशनल आपके हेल्थ रिलेटेड सवालों का रियल टाइम में जवाब देते हैं। For today's Dr. R, we are honored to welcome Professor Dr. A. Nithyanandam, a distinguished neurologist and healthcare leader. He is the professor and head of department at the Tamil Nadu Government Multi-Super Specialty. He holds an MBBS, MD General Medicine, DM Neurology from Stanley Medical College and MBA in Management from Madras University, and has a PG certificate in Digital Health from IIM Raipur. His professional achievements include prestigious fellowships such as FRCP London, FRCP Glasgow, and FIMSA. Dr. Nithyanandam has been recognized with numerous awards, including the Best Doctor Award in Neurology, COVID Warrior Award, and a Certificate of Honor for services during the Chennai floods and the COVID-19 pandemic. With a special interest in stroke and myasthenia gravis, Dr. Nithyanandam has presented papers at regional, national, and international conferences. He is a life member of several prestigious medical associations, including Associations of Physicians of India, Indian Academy of Neurology, and Indian Stroke Association. His extensive experience and his leadership in critical care neurology make him a valuable voice in healthcare today. We look forward to his insights and expertise today. We welcome you, sir. शुरुआत करते हुए मैं सभी पार्टिसिपेंट्स को एनकरेज करना चाहूंगी कि आप इस मौके का फायदा उठाएं और अपने कोई भी सवाल हमारे Q&A सेक्शन में लिखें। अगर आपके पास कोई भी स्वास्थ्य संबंधित कोई भी चिंता या कोई स्पेसिफिक कंडीशन के बारे में आप जानना चाहते हैं तो एक परफेक्ट समय है एक्सपर्ट एडवाइस लेने का। सो विदाउट फर्दर अडू आज के डॉक्टर आर की शुरुआत करते हैं। आई रिक्वेस्ट सर टू प्रोसीड फर्दर। थैंक यू।
So I am Dr. Nithyanandam. Thanks for the nice introduction. I think most of the viewers are non-medical person. So I thought, let me choose a topic which is good for the aged people or who are all going to be aged, right? First slide. Worldwide, people are living longer. Most people expect to live more than 60 and beyond. By 2030, 1 in 6 in this world will be more than 60 years. Every country is experiencing growth of older person in this population. You know why? The healthy living. People started to live health. The awareness of health is more. And we are able to control the infection. We are able to take care of the patient. With immunization, particularly elderly people with pneumonia vaccine, other vaccines, they're able to protect from deadly infection. If a person gets any sort of health ailment, easy transportation, ambulance service, 108 service is available everywhere in India. So this makes a person to attend or seek healthcare professional at the earliest. And the government initiative. WHO is more concerned now. They want to prevent the disease rather than treat the disease. So Because of all these things, people live longer in India. Earlier, people after retirement, they hardly live for 2 to 3 years. When we want to search for people who are more than 70 years, only few will be there. Now, the more than 60-year population is increasing. Next slide. So, pace of the population of aging is much faster. Earlier, from 2015 to 2050, world population more than 60 years will double from 12 to 22%. Nearly, it will outnumber. The number of people aged 60 years and older will outnumber children younger than 5 years. Basically, our country will face more of elderly population. In 2050, by 2050, 80% of the older people will be living in low and middle income countries, not only in India, throughout the world. All countries face major challenges to maintain health and social systems of these elderly people. Next slide. When you look at the demography, almost female people will be more than the male. So female survive longer than the male. Next slide. So how about funding? So we all know that aged people are increasing. Their healthcare needs also increases. But are our people or our government spending adequately for the old age people or old age homes? See, Andhra Pradesh stands out to be the first, earlier before this bifurcation. Next comes Karnataka and Tamil Nadu. These are the funds. I took this from integrated program of older person. It shows that still we are lacking. We are not allotting adequate fund for these elderly people. Next. Age population, India and China. When you look at the chart, you could easily see that in China, already they superseded. Only people are old or living more. Next slide. This is just to highlight that everywhere there is a problem. India is also facing the problem. We are near China. We are getting old people now. So am I looking old or I'm old? So people, even though they are old, still they are active. Some people, just because they got retired, they feel older. The feeling is more important. Never ever feel that you are old. Still they are active. Next slide. So what is old age? Aging is a process during which structural and functional changes occurs with the passage of time. Everywhere there is a structural change, head to foot, brain, heart, kidney, liver, intestine, our skeletal system. Everywhere there will be structural and functional change. This one has to understand. There is a decline in peak fertility and physiological functions until death. Next slide. There are reasons of variations of age people in health. Genetic, sex, as I told earlier, female live a little longer, ethnicity, people in Japan, China, they live longer. Mostly to people's social homes, neighborhoods, and communities, as well as their personal characteristic. personal characteristics have long-term effect on how they age. This I will explain at the end of the talk. Next slide. Next, please. So never think old. Even old whiskey is costlier. I'm not old, I'm vintage. Don't care how old I am, I'm going to the Bounty Castle. So mindset is very important to decide about your age. If you think that you are old, you'll be old. If you think that you are young, even when you are old, you'll be young. Next slide. So what are the problems happens to old age people? Beyond biological changes, aging is often associated with life transition. People will retire. They'll be first class 1 officer. The moment he retires, all his facilities goes off, he gets depressed. Reallocation to more appropriate housing. They'll be living in big bungalow, government bungalows, but they'll be shifted to small houses. This changes their mind. Some people, they go to old age homes. They'll be left alone. Death of friends or partners all play a vital role in deciding about the mental status of an aged person. Not only biological, other issues are play a role on these people. Next slide. Just to say that what are the problems faced by senior citizens in India? Not only in India, everywhere. Next slide. So now we know people are getting older. They live longer. So I'm going to restrict to only to some neurological issues what these aged people face. These are the common neurological issues that a person faces. Headaches. Apart from that, for namesake, I added hypertension and diabetes, but main issues headache, epilepsy or fits, fainting episodes, syncopal attacks, vertigo, giddiness, stroke, neuropathy, nerve problem, burning feet, Parkinson disease, dementia, memory problem, and psychiatric issues. I have listed the common neurological issues faced by elderly people. Next slide. So let me go one by one, few important points to be carried away. So when to give importance? Anybody who has pre-existing headache, no issue. If they have new onset of headache, a person never have headache, getting one-sided headache. So be cautious. It still could be a newly detected hypertension. Not only problem can be in the brain, it could be still problem in the eyes, pressure in the eye, we call it as a glaucoma. People, aged people, sometimes if you're obese, you don't sleep well. Because of that, carbon dioxide retention happens and they get headaches. So obstructive sleep apnea, snoring. Those people morning time, they can have headaches. And hypothyroidism, sometimes they can start with headache. So when to give importance? Which headache to give importance? If anybody has headache with vomiting, giddiness, fits, weakness of body or weakness of limbs, and unsteady gait, it is the most serious one. If anybody has the following symptoms, vomiting, giddiness, fits, weakness, and unsteady gait, they have to take it into a serious issue. So it could be bleeding in the brain, intracerebral bleed, or stroke, giant cell arteritis, problems of the blood vessel or any growth in the brain, tumor, infection, or cancer in the brain. Next slide. Commonly, elderly people, they complain of fainting episodes, dizzy, syncope. So the moment they come to the clinic, they'll say, I'm dizzy. I fainted. I lost consciousness. So these are the common causes for the fainting disease syncope syndrome. Anemia, low HB. If your hemoglobin is not adequate, well, if it is less than 7 or 8, your oxygen carrying capacity by the RBC, by the cells will be less. So oxygen will not be delivered to the tissues and you get easy fatigue. Some people with pre-existing cardiac or heart issues, they may be taking medications, BP medications. Those BP medications can produce postural fall in BP. So that can produce disease syncope whenever they get up suddenly or turn up suddenly. Particularly people with the prostate medication, they can have this postural dizziness. So whenever a person has headache, whenever they have dizzy, think that whether it could be medication induced. If it is postural. If they have bleeding in the gut, so black stools, so blood anemia can happen. Low HB anemia that can produce dizzy and fainting episodes. Low sugar also can produce fainting and dizzy. If heart beats irregular, they can get dizzy and syncope. So common things are low sugar, anemia, medications, and loose stools. Next slide. So again, simple explanation. Syncope, whenever you get up from sitting posture, suddenly, elderly people, diabetic, on BP medication, the blood flow to the brain will not be adequate. It will not happen quickly. There will be postural fall in BP. So they get dizzy. So sitting to standing should be slow whenever they become old. Never get up from the toilet urgently or go to the toilet urgently, or early morning when you want to pass urine, don't get up from the bed suddenly and go to the restroom. You may faint and fall. So early morning fainting is commonly due to lack of blood to the brain due to medication. So also never ever lock your restroom when you are alone when you become old. So when you get up, suddenly go to the restroom, strain yourself, the blood rushes down rather going to the brain and you faint, you'll not be able to open the door also. These are the common issues that I'm getting call over early morning. So never ever rise from the sitting to standing posture suddenly. This is a take-home message for the elderly people, particularly early morning. Next slide. So what is vertigo? Room spinning sensation. In the ear, we have semicircular canals. So there are some fluid in the both side of the middle ear. So that movement of the fluid balances the head and the eye, the position, everything. So if there is any change in, or if the fluid is not able to adjust quickly, you feel dizzy. That is called as vertigo, entire room spinning sensation. It is not related to any neurological issue. However, if it has some particular symptoms, then we have to give importance. Most of the dizziness, vertigo, are due to vestibular problem in the middle ear. Next slide. Next slide. So what to do for vertigo? simple exercise, which as it is very well given in the, Google Images, YouTube, etc. Neck exercise, an exercise to the eyes will settle your issue. No need to be worried. So, vertigo, once it comes, it will come again and again. So the best treatment is not medication. By doing this neck physio and exercise, you'll be all right. Next slide. So seizure. Seizure is nothing but fits. So anybody with low sugar can get fits. So there are other causes of fits also. Suppose if your body's sodium, magnesium, calcium levels are low, you get fit. It is like a fever, one symptom. So fits could be many reasons. So when you are old, when a person is diabetic, always you should check the sugar when they throw fits. Cardiac dysarrhythmia. If heart beats too fast, they can get fits. If any stroke or bleeding in the brain can produce fits. Tumor, infection, this hot summer heat stroke can also produce seizure fits. Lastly, without any reason, people can get fits. So people may think that jerking of limbs alone is fits. Not necessary. By blinking without any awareness itself can be fits. Some people can have simple loss of sensation for some time and recovers immediately. That could be also a sensory seizure. Next slide. So what to do when a person gets fits? Main is whenever a person gets fits, injury occurs. They aspirate, self-aspiration occurs. They can bite their tongue. So our aim is to prevent the tongue biting. So keep the person in lateral position like this. Avoid injury to the head. Then place a kerchief or anything in between the teeth so that they don't bite the tongue. Left lateral position prevents self-aspiration. After some time, fits will subside on its own. No need to give any iron rod or keychain or anything. Just keep the patient on lateral position, keep them calm, prevent the injury by keeping a handkerchief or rubber, anything between the teeth so that they don't bite their tongue. Later, you can sprinkle water. No need to feed anything orally. Immediately, if facility is available, check the sugar. If sugars are normal, then it could be something else. Next slide. So when to give importance? Repeated vomiting, headache, fits, giddiness with numbness around mouth and face and limbs, speech disturbance, loss of vision, double vision, facial weakness, swallowing difficulty, or unsteady giddiness or unsteady gait. If a person gets all these things with dizzy or seizure or giddiness, we have to be very careful. There could be a serious neurological issue that we have to take into account. Next slide. So stroke could be, as I told earlier, anybody with fits, weakness, double vision, speech disturbance, it could be a stroke. Stroke can be two types. One is ischemic, we call as blood clot, simple. Another one is hemorrhagic, bursting of the blood vessel. Ischemic or blood clot is similar to heart attack. If blood flow to the heart reduces, you get heart attack. Same, if it doesn't go in the blood vessels of the brain, you get stroke. Uncontrolled blood pressure can produce hemorrhagic stroke. Other causes of hemorrhage could be any congenital abnormality. By birth defect of the blood vessels, that ruptures can also produce hemorrhagic stroke. Next slide. So what are the causes of stroke? Having aware that a person becomes dizzy, if they develop speech disturbance, weakness, fits, they can get stroke. Could be hemorrhagic stroke or ischemic stroke. So what are the causes? Hypertension. Uncontrolled hypertension can produce both ischemic stroke and hemorrhagic stroke. Uncontrolled diabetes, obesity, taking alcohol, heavy alcohol, cardiac causes like arrhythmias, substance abuse, drugs, sedentary life, keeping idle, not walking, other congenital causes. Eating junk food is the main concern now. Young people, they become obese and they get early stroke. Next slide. We all know that cholesterol blocks the blood vessels. So how does it block? Look at the picture. This is the normal circumference. So as you eat more fatty food or cholesterol containing food, the lumen of the blood vessels blocked by the cholesterol deposits. When you look at the slide, it shows that how that RBC getting blocked between those yellow color cholesterol plaques. So narrowing causes rupture and injury to the platelets, and it produces small blood clots and produces stroke as well as heart attack. Next slide. So a word about good cholesterol and bad cholesterol. So that blue color are HDL, good cholesterol. Yellow is the bad cholesterol. If you have more good cholesterol, the lumen will be more and the blood flow will be easy. Bad cholesterol blocks the circumference of the artery. Next slide. So what are the symptoms of stroke? As I told earlier, whenever there is, so B fast is the code, whenever there is imbalance while walking, sudden, eyes, double vision, loss of vision, facial deviation, not able to hold air in the mouth, any weakness of the hands and legs, speech disturbance, that could be a sign or symptoms of stroke. Rush immediately to doctor. You know why? If it is ischemic stroke, that is stroke due to blood clot, treatment are available. If you reach within 4.5 hours of ischemic stroke, if you reach within 4.5 hours, and clear your clot. Beyond that, only secondary prevention, preventing the future attack, only possible. Next comes the old age problem, Parkinson disease. Earlier, when we studied medicine and in MBBS, to see a Parkinson person, we would wait for months together, because those days people will not live longer and the Parkinson disease is less common. Now, every day I'm seeing 3 or 4 new patients with Parkinson disease, which means that people are living longer. Basically, it is a disease of old age. Everything becomes slow down, walking, talking. They can have tightness of the legs and they can have less arm swing. They will have less facial expression and shaking of hand. Famous person, boxer, Muhammad Ali, they have this Parkinson. That is because of repeated boxing injury caused Parkinson disease. But not necessarily everybody to be a boxer. So Parkinson is an old age issue. In the brain, the dopamine is not secreted properly like insulin for a diabetes. Here, dopamine is like a petrol. If there is a petrol, the car runs. If no petrol, car stops. Similar to that, If dopamine is not there, people can have slowness of all activity, walking, talking, thinking, everything becomes slow. They tend to fall, they will have giddiness. There are other symptoms similar to disease, similar to Parkinson are there, but common is treatable condition Parkinson. Next slide. So as I told earlier, slow movement. They'll be walking very slow. They will not have any good expression, dull face, loss of automatic movement, like arm swing will be reduced. So they will have impaired postural balance. They will have shaking of hand. They cannot speak properly. They cannot write properly. All letters will become small. They will not be able to sign their check as before. They need to get a certificate from the doctor to put thumb impression to withdraw money. Next slide. So again, a similar expression only, just to highlight, because these are a potential old age issue faced by people. Next slide. Finally, the dementia. Now people, earlier they used to say, only in America, people having Alzheimer's type of dementia. Now we could see more of people having dementia during the early age itself. Dementia is nothing but loss of ability to think, to remember, so that their day-to-day activities are smooth. But if you don't remember, all your day-to-day activities become troublesome. Alzheimer's disease, Lewy body dementia, vascular dementia, frontotemporal dementia, other Parkinson and Huntington's. These are various types. Vascular dementia is nothing but memory problem occurs due to repeated stroke of the brain. Parkinson, as I told earlier, because of lack of dopamine, other neurotransmitter, which helps in propagating memory functions. Alzheimer's disease is genetically determined, wherein without any reason people lose their memory and neuronal cell function goes down. Next slide. So these are the signs of dementia. Difficulty with everyday tasks like cooking, remembering, they will lose. Particularly short-term memory. They'll be able to remember long-term memory. They'll not be able to come back to your home. If they go to market, they'll not be able to get the exact change. They will find difficulty to come back home. Difficulty in communicating. Later they'll be unaware where they are sitting. They'll not be able to wear dress properly, do day-to-day activities normally. They will have abnormal, because of this, they will have abnormal behavior, mood changes. The commonest cause of treatable dementias are B12, low B12, low folic acid, thyroid, and psychiatric issues. One more treatable cause of dementia is subdural hematoma. If anybody has fallen down, injury to the brain, bleeding in the brain can produce subdural hematoma, can cause dementia. These are all potential treatable dementias. Low B12, folic acid, thyroid, SDH, and psychiatric issues. Other dementias very difficult to treat. Next slide. Can it be revised with the vitamins? People think that, shall I take a lot of vitamins so that I will have good memory? So clinical trials have done. So it does not appear to improve cognitive function. So by taking vitamins will not improve cognitive function unless those vitamins are less, like vitamin B12, folic acid, or thyroid. Next slide. So how to improve that? So minimize your diabetes, treat your hypertension so that you don't get stroke, prevent head injury, stop smoking, reduce air pollution, reduce obesity, maintain frequent exercise, reduce your depression, avoid excess alcohol. Next slide. The best way to keep your memory function goes. This slide is very, very, very important. All elderly people should try to learn music. They should change their routine. If you are not have the habit of reading, you start reading now. Learn new skills. There is no age limit for learning computer. Buy one laptop. Learn new things. If you are interested in photography, do that. Learn music. Different things. Learn a different language. No matter who bothers whether you pass or fail. But if you learn a new skill or a new thing, your memory function doesn't go down. Sudoku is a good form. You try putting that. Next slide. So everybody knows diabetes and its complication. Diabetes can affect the eye, produce retinopathy. If it affects the heart, you can get heart attacks. If it affects the nerves, it produces peripheral painful neuropathy. They can get leg ulcer, they can affect the kidney, get renal failure and stroke. Next slide. So chronic, poorly controlled diabetes, their nerves can get damaged. They can get burning feet syndrome, pins and needle sensation, like as if they have kept their legs in the fire. Temperature changes, they will not be able to feel. They will not be able to walk properly. They will not be able to feel the floor sensation. This causes injury. Next slide. So the basic pathology, basic problem with diabetic nerve issue like burning feet syndrome is the blood vessel which supplies the nerves get damaged because of your poorly controlled sugar. By giving any number of medication, this will not be reverted back. Only control of blood sugar only will help to reduce those symptoms. And doctor can give only symptomatic treatment rather than treating the neurological function. Next slide. So other issues are cervical spondylosis, wherein everybody will have neck pain, low backache. Both needs exercise than medication. Elderly people are vulnerable for early kidney failure. Even a single painkiller will damage your kidney. So avoid painkillers. For neck pain, spondylosis, the moment you go to any doctor, doctor will say you are having spondylosis, you are low backache, do MRI, then they will write medication. Never do that. Whenever you have any weakness only, you should do MRI, or else no need. Do the exercise that will help to relieve your cervical pain and low back pain. Do not lift heavy weight. Lifting heavy weight can produce acute disc problem. Reduce your weight and obesity. Healthy position while sitting and watching TV. This is very important to prevent low backache. Next slide. I'm coming to the final few slides. I think many would have read about this Ikigai. People in Japan live longer. Why do they live longer? Ikigai is a Japanese concept that means a reason for being, aiming to achieve the balance between spiritual, practical aspects of life. There are 10 rules in Ikigai. Next slide. Stay active. Don't retire. Even if you retire from government service, don't think that you have retired. You are having many things to do, many untouched things. You have not thought of while you are in service. Do that. Be active. So never think I'm old. Am I looking old? No, I'm not old. Take it slow. No need to rush. Do everything. When you get aged, never do things very fast. Getting up, turning, walking very fast can produce less blood flow to the brain and you may faint. So take it slow. Don't eat full. Let 80% eat 80%, 20% be empty so that no reflex happens. Surround yourself with good friends. This is very, very, very important. If you feel you are young, your friends feel young, you will be young. If you feel that you are not okay, others will not be okay. Get in shape for your next birthday. Always think that you are going to survive. Never lose hope. Keep smiling. Reconnect with nature. Go for frequent trips. Vacation. For everything, say thanks. God has given everything. You have survived for more than 60 years. God has thrown mercy to you. Thank everyone for everything. Live for this moment. Don't live for the next day or tomorrow or next year. Today, you're having this, be happy with that. These are follow your ikigai, which means that you have your thought, you will be having something. You follow your ikigai. Next slide. So what you love, you do that. What the world needs, you do. Which means that, what your people in the house needs, you do that. They need little help, you help. So that will bring you happiness. Do what you are good at. If not, learn new things. Do what you can be paid for. Paid means not money. Here, recognition. If they recognize you for doing this, you do that. Be professional. Be passionate. Enjoy your vacation. Have a little mission. Each one will have their own ikigai. Next slide. With this, I conclude my talk. Happy to take questions. So never ever think that you are old. Still you can do wonders. Change your attitude.
I think it was a very detailed topic and we have a lot of questions with us. So I'll be putting one by one to you and then you can answer accordingly.
Okay.
Sir, so the first question is, how can early symptoms of neurological disorders often be mistaken for normal aging? How can they be distinguished?
See, as I told you earlier, neurology, there are many things are there, right from your memory problem or your Parkinson slowness of activity, then your disease, syncope. What I commonly see from the old people is they come with dizziness. Sir, I feel dizzy. And when I walk, I feel dizzy. Or when I turn my head, I feel dizzy. So this could be a simple, it could be a Parkinson disease. It could be still a vestibular problem, not necessarily a neurological issue at all. So whenever they have any numbness, weakness, double vision, or unsteady gait, any memory issues, then only they should see a neurological person.
Thank you, sir. The next question is, how do treatment approaches differ for elderly patient compared to younger population?
Yes. So the younger population, the creatinine, kidney function will be very good. So when I want to start any antibiotic, for example, today in my ICU, there was a patient with sepsis. His kidney function is 1.4. I have to adjust the medication because kidney will not secrete certain medications. So the medication dose will change with age and change in the kidney function. That's how we decide. We check the GFR, glomerular filtration rate of any medication, and we adjust according to that.
Next question is, what are some of the major recent advances in the management of neurological disorder?
If any particular means, it will be easy. See, it is coming up. People are trying with the stem cells. For Parkinson's, they are using implantable devices, other things for Parkinson. For stroke, the thrombolysis is the newer one. Earlier, when patients get stroke, we give only aspirin. Now, if they reach within window period, we give clot lysis medication. Within 24 hours, if the clot is there, we go like what they do for cardiac, do angio, retrieve the clot. And some for genetic disorders, some treatments are coming up. Most of the newer treatments are available for demyelinating diseases, which doesn't happen that much for older people. Middle-aged people only get demyelinated disease. A lot of newer treatment regimens are available. Immunoglobulins, we say.
So the next question is, what mental health consideration should be kept in mind for both patients and caregivers?
Mental health. Be happy. Never take stress. Never take stress. Try to keep your memory function full by learning new things. Brain remembers with association. If you want to remember a page means, it will associate to a certain issue, then it will bring down. For example, if I want to read something, if I hear a song, I'll write down. Next time, if I hear that song itself, I'll be able to remember that page. So it is associated. Brain is having an associated memory. Suppose we want to remember this talk, Arushi. Oh, Arushi was there. Then I remember this talk, like that. Association. So try to learn new things, music, photography, paintings, will all improve the. Yeah, next question.
So the next question is, which area do you think needs the most innovation in neurological care?
Brain. Now, see, you know that everywhere it is artificial intelligence. Brain is the best artificial intelligence machine. It does like a same computer. Research are going for brain. Why does this happens? See, people with straightforward people doesn't think bilaterally, whereas criminal people think in multiple angles. Their brain is faster than yours. They train like that. So brain, I think future growth will be the research in the brain only. I think research is going on.
So the next question is, what role does diet and exercise play in maintaining the brain health?
So by exercise, your mind calms down. Your weight comes down. If your weight comes down, your sugar gets controlled, your BP gets controlled. Ultimately, everything helps the brain to do better. Next.
So the next question is, how often should elderly individuals be screened for neurological health?
I would say every 6 months they should go for regular, blood sugar, cholesterol, if male prostate checking up and doing ultrasound. And if they have frequent constipation, do check their thyroid and do, if necessary, do colonoscopy. If anybody who has weight loss, unexplained fever, then they have to seek immediate attention. You cannot wait.
So the next question is, how can we make neurological healthcare more accessible, especially in rural areas?
By digital health. By digital health. Sure. See, I told if suppose a person comes with disease, he's not able to come to Chennai or cities. He can easily access to a digital health person. He can tell you the symptoms by video consultation. They'll be able to pick it up. Most of the time, it will be Parkinson only if elderly person this disease. If not, we can advise, do good advice and prevent them coming to city unnecessarily waste time, money, everything.
So I was just trying to conclude, since there is a lot of technical issues. We do have questions. I have asked them to put them in the app itself
Okay.
or write to us through email, which I'll be able to share with you, and then you can pass the answers accordingly.
Sure.
What I do is I'll add you to the Patients Union app, and people can directly write their questions there, and you'll be able to answer them directly from there. So
Okay.
I hope that also works. And I was just extending my thanks to you for sharing your valuable insights with us and for answering all questions. So thank you so much, sir.
Thank you.
एंड साथ में मैं आप सभी पार्टिसिपेंट्स को भी धन्यवाद करना चाहती हूँ. आपका एक्टिव पार्टिसिपेशन की वजह से आज का सेशन और भी एंगेजिंग बन गया है. हम उम्मीद करते हैं कि आपको जो भी इंफॉर्मेशन मिली है उसका आपके हेल्थ और वेलनेस को मैनेज करने में मदद करेगी. जैसे कि अभी कुछ सवाल रह गए हैं तो आप हमें पेशेंट्स यूनियन ऐप डाउनलोड कर सकते हैं और उसी पे डायरेक्टली लिख सकते हैं, जहाँ पे सर आपको आंसर करेंगे. और साथ ही आप अगर हमें ईमेल करना चाहते हैं तो office@patientsunion.org पर भी लिख सकते हैं. Thank you once again for being with us today. We look forward to seeing you at our next Doctor Hour. Have a wonderful evening ahead. Thank you.
Thank you. Thank you. Namaste.